Okay. All right, Kelly, go ahead whenever you're ready.
Okay, the Sexual Offense Treatment Board meeting is convening at 9:06 a.m. on May 14th, 2021 at the Health Licensing Office in Salem, Oregon by teleconference call. I will now call roll. Kelly Clementi, here. Michelle Rowland-Schwartz.
Here.
Kelly Crane.
Here.
Joe Ferguson.
Here.
Malcolm McDonald.
Here.
Bill Davis.
Here.
Jeremy Howell.
Jeremy will not be attending today.
Okay. Members, when you wish to speak, please state your last name for the record. For the record, public members calling into the public phone line are asked to email April Fleming at april.fleming@dhsoha.state.or.us and provide your first and last name. Public and interested parties' feedback may be heard during the public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. This meeting is called to order.
Good job, Kelly. All right, your guys' first item on the agenda is approval of the agenda.
Okay.
Rowland-Schwartz, I move to approve the agenda.
This is McDonald. I second it.
So I don't have the scripts for that, but can I just wing it?
You just do go through the roll call again, and don't forget your name, and then the individuals just indicate with yay or nay.
Okay. Kelly Clementi, aye. Michelle Rowland-Schwartz.
Rowland-Schwartz says aye.
Kelly Crane.
Crane says aye.
Joe Ferguson.
Joe Ferguson, aye.
Malcolm McDonald.
McDonald, aye.
Bill Davis.
Davis, aye.
The agenda has been approved.
All right, perfect. So now it'll be a whole bunch of Sylvie talking. So we'll go on to reports. So director's report. Legislative overview. We're going to get into a bill that's specific to you guys a little bit later. But there's a lot of bills, obviously, that the office is working on. One is a new program that will come to the office, which is genetic counselors. That will be a program, not a board, but it is another one added to our current 16, which again then divvies up the staff and so your percentages, when we get to the financials, those percentages will change yet again once that that program comes on. And then there's a bunch of changes that occur to several of our other boards, cosmetology, which licenses estheticians, and then advanced estheticians. There's a lot going on trying to differentiate what those two fields of practice are and what they include. So that will be a huge change for us. A bunch of other stuff related like to behavior analysts, some regulatory stuff, some housekeeping stuff. The housekeeping stuff talks about when complaints are received and what about those complaints is public record and what is not. So the public record law changed, but they weren't clear on when the change actually went into effect. So that's just some housekeeping stuff, but it comes down to when and what we can disclose for records. Again, we'll get into Senate Bill 820 in a bit. We had a couple other ones that have not passed the several deadlines. Michelle knows a lot about this. There's several deadlines. One was a board that was going to be created under us for sign language interpreters. That now is put on hold. They're wanting to bring that back forward in the short session in February. There were some concerns from the Oregon Judicial Department regarding sign language interpreters that deal with cases in the court system, and the way the law was written, those individuals have to be certified through us before they can interpret for cases, and they kind of had some heartburn with that because of the need for speed, the need for, I need somebody this minute versus I can't wait until they get certified. So trying to figure those little things out. Again, that will be another board moving to us. That would get us up to, so we'll be at 17, that would get us up to 18. And then there's another bills that move 6 independent boards underneath of us. They will, as long as those go through, they will move to us in July of next year. So that would get us up to, what, 24 then?
Wow.
Yes, so big changes coming on. Obviously, it doesn't affect your professions, but it does affect the board and the office and how everything gets divvied out. With those 6 boards coming over, they are established boards that have positions and personnel. However, those positions and personnel aren't necessarily the same type of positions that we in our office need, the way that our structure works. So there's a lot of behind the scenes that has to be done with that and with DAFs. Which does mean, though, that there would be new positions coming over to help with the workload. So lots of changes, and that will really affect your guys' expenditures in the office and all that stuff. So kind of giving you a heads up on that. When we get to your revenue section, I have some positive news. So that'll be a good thing. But these major changes may also have an effect on that, too. So, you know, if we just stayed the same and the legislation would just leave us alone for a while, everything would be great, but that will never happen, so. All right, let's move on. So COVID-19. So, most of you, I'm sure, have all heard about the CDC recommendations and the masking and all that stuff. However, the governor has not come out with some clear directive for us state agencies on how to deal with that yet. We currently are still open by appointment only and only for testing. You cannot come in here and renew your license or submit an application. It's only for testing because those individuals have.
We can't hear you.
We lost your audio.
Kind of. Go help.
We need a sign language interpreter.
Or a lip reader, one or the other.
Right.
I got that.
Yeah, she could call in.
That was a strange technical difficulty. Suddenly just cut out.
Hey, move over, buddy.
Good. Yeah, hang on.
Okay, so I kicked Trampus. So my name is Trampus now. Can you hear me? Okay. So I just came in here because I couldn't figure out my computer. I was having issues earlier this morning too. So, and apparently I didn't 100% fix it. Okay. And I just grabbed all my papers and ran.
Okay, we're starting with
COVID-19. Okay. So I don't know when I cut out because I just kept on talking until
last
one
thing
of you.
said you can't come in here and renew your license.
Until one of you said I can't hear you anymore.
We heard you say that the governor doesn't have a specific plan for the agencies, and then they kind of cut out after that.
Okay. So she's working with OHA to kind of figure out some guidelines. Again, not knowing like how to deal with who's been vaccinated versus who has not been vaccinated, positions, and
there's a lot to work out. Her goal is to have state offices open no later than September 1, regardless of how things go. That may occur sooner than that, but it will kind of depend on how things go. And then hopefully we will somewhat be back to normal in the office. But until then, we're still closed, like I said, by appointment only, and staff are still doing as much working from home as possible. So, any questions on that? Then we have personal services guidelines that we've printed out, not necessarily for you guys, but several of our boards. And those, I think, are going to start changing due to the mask and the vaccinations. So we'll kind of see how that goes. But there's my agenda. Licensing and statistics. So let's move on, unless anybody has any questions about the COVID stuff. No? Okay. Let's move on to statistics. So a couple of things, when we're going through these, we're going to talk about what you guys want, how well these are working, is it information that's pertinent or not, and some things that we can maybe change to get things updated or to be more important or maybe less pages. So the first page talks about licenses or certificates issued and renewals. So I think this is great information, especially when we have new, board or new certificate types coming on. So this shows like the interns and the secondary clinical now. And I got used to calling it secondary associate, and then I had to call it secondary clinical, and hopefully it doesn't change again. Just kidding. But I think that this sheet is important. I think that gives great information. Obviously it shows, that we have now 5 interns, which I think we thought there'd be more, but that's better than none. All right, next slide. This one shows the long-term trend, and I like this one too. I think it's pertinent, but anytime that if you think it's not, then just let me know, or if you want to maybe change how it looks, let me know on that too. This one is the average per quarter, so it's not, because it's always just a snapshot in time. You can always have somebody who chooses to renew late, or, so it's just a day and time. This is what the numbers were, but it gives you what the clinical, the associate, the intern, and the secondary clinical. And it kind of shows down at the bottom the growth rate over the years. And remember, our years are from July 1 through June 30th.
Hey, Sylvie.
Yeah.
This is Kelly. I have been looking everywhere. All I have is the agenda, but I don't have all of the reports. So I don't know if I missed an email somewhere.
You missed an email.
Okay.
So what if,
I don't know.
it's okay.
It was in the calendar invite. They were all embedded in the invite for the meeting invite.
Yeah, so I remember seeing the invite, accepting it, and then I don't know, anyway, I can't find the email somewhere.
If you click on your calendar and open it up, it would be in you're using.
Yeah, it didn't go to my calendar.
It's okay. April's listening. She can email it to you real quick while we're still talking. Yeah.
Thank you. Sorry, I just wanted to, I was like, well, I could just kind of fake my way through it, but I figured I'd rather just do that.
Yeah, no, that's fine. No, you're fine. Yeah, April's listening. She'll email it to you here shortly.
Thank you.
All right, so the next slide, and this is also a snapshot in time, and it has the date up on top. So this was as of May 5th. And so with these, one of the things that I would like Nathan to do, and Nathan's listening, is to put a total, because there's no grand total on here, so you'd have to sit here and do math. But as of May 5th, if there was a grand total, it would tell you how many active clinical certificate holders there are. But this currently breaks it out, so the green is female, blue is male, and then how many individuals in that age group. But I think it would be nice to have a total. What do you guys think?
Yeah.
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 Because some people are really good at adding that many numbers up in their head real fast, but it would be easier if there was just an actual number that said a total. The next one, again, obviously needs a total, but there's a lot smaller numbers here, so it's easier to add them in your head. but it's for the associate. So this is how many active associate certificates there were as of May 5th, again broken out by age and gender. Next slide is the secondary clinicals. So you can see that there's 3, 4, 5 females and 2 males. And again, broken out by age. And next slide shows interns. So there's currently 5 active interns as of May 5th. 4 females and 1 male. And interesting that the 1 male intern is in the age of 66 to 73.
Yeah.
But it's interesting information. All right, the next slide, and this is something you guys had asked for at one point. Don't know if it's still relevant or not, and it's kind of hard to read, but this is the slide that shows the different certificate types then broken out by the county of residence. So again, we do not keep track of where an individual works or what county they work for. So it's kind of deceiving information because this is the county of their residence. So obviously Multnomah County has the most. And you can see down on the bottom, Douglas, Polk, Josephine, Crook, they all have 1. Is this still a chart that you guys find interesting, needed? We have no problem leaving it if that's what you want, changing it, deleting it.
I think it's helpful. I think we still, being able to identify statewide kind of where we have gaps. I don't know, the thought of putting it on an actual map with a representing the counties as opposed to a bar graph. It might be, I don't know if that's an option or not.
Well, that would probably help for those that are of us that don't exactly know where all the counties are.
I know where they all are out, but it's nice to kind of like, oh, okay, there's a gap in this particular region, and you know, something that can be talked about and amongst our groups too, that we each represent. It'd be helpful because that's from the community side, you know, and the organization I represent. That's where we hear the struggle is in some parts of the state. Is getting people certified and that want to provide a service that's within a reasonable driving distance. So
Absolutely, and that was, you know, that adds on to why we have the interns, why we have the secondary clinical. It's all in there, but yes.
This is Joe Ferguson. I agree, because if you look at that chart, that's only 22 of our 36 counties. It would be nice to see that on a map in terms of the regions.
Sure.
And Mrs. Crane, is there any way we could get the information of where they're practicing rather than their residence?
This is Sylvie. They do not have to, nor do we require them to tell us where they work. That is not part of anything to do with their license. That would maybe be an association thing, but that is not part of the license. The license is, you know, you have to have this in order to practice. We have to have your personal information. Where you work is, we don't care unless you're under investigation. Then we might start caring where you are.
do we track if they serve adults or youth? Okay.
No, because the certification doesn't differentiate. It's just you're either a clinical, an associate, secondary clinical, or an intern. Whether you and having the clinical certificate, you can do whatever. If you want to do juveniles or adults, that's your choice. And you know, obviously, people will start to specialize in one or the other. But that license that certificate allows you to do either. So.
Okay.
All right, we'll look at putting this on a map. We'll see if we can do that. That gives Nathan something to play with between now and the next time you meet. He's in the room now. See, now with me in the room, I can actually make eye contact with these people. All right. Next slide is your financials. So, as you know, you guys have been in the negative for quite some time. However, we've been slowly working on it. And if you look at down where it says that the ending cash balance, So the first column was for 2017, so mind you, that's as of June 30th of 2017. 77,000 in the hole, 18, 65, 19, 46, 20, 26. So hopefully within the next 3 years, it might be in the positive. Yeah. Well, and then all those changes will come to the office and we'll see how that works. But hopefully they don't move us around to another agency or move us, well, if they end up moving us independent again, who knows? All the changes constantly will affect how expenses go and what's going on, so, but we'll see. And then down in the grade area shows the assessments. So the first one, the shared assessment, that is shared between currently all 16 boards and programs. We try to adjust it every July 1, which is when our year starts, because we're always having changes. So you can see down there what percentage you guys are paying. So currently, because we keep growing, you're only at 0.03 or 0.13%. So that's the shared services. So shared services would be rent, the utilities, anything that all 16 boards and programs have to pay. You guys pay 0.013% of that. So that's how we can keep your expenses down. The small board assessment, you're currently at 0.093. So a small board assessment, there's 3 positions that work on small boards and small boards only. They do not work on cosmetology. And so those positions then get divvied out and paid for by all 15 of the smaller boards and programs and not cosmetology. Normally cosmetology pays close to 90, I think almost 93% now. So, because they're so large. Any questions on the financials before we move on? Nope. Okay. So let's get into the regulatory report. So this again looks new. It's a different format. So this on the left-hand side will show you the types of certificate holders that the complaints are filed on. So the associate, the clinical, and then unlicensed individuals. And up on top, at the top of that box is the cases that are still open. Down below are the cases that are closed. And then the total cases that were received for that biennium. And then over on the right-hand side, it says how those complaints came in. And the complaint type. For you guys, it's pretty obvious because you guys are service providers, so you're obviously not going to have a safety and sanitation complaint because you don't have that. But we do break it apart so that for specific boards that has several different categories on why the complaint's coming in. So, any questions on this new report? Okay, so you'll see there that for the 1921 biennium, the total is 16. And there's 11 of those that are still open. So there's several cases on one incident. We were getting really close to being able to bring that case to you today. However, we weren't quite done with it. So we're either going to bring it to you at next board meeting, which is
November 12th.
Most likely, we're going to need you guys to have a meeting prior to the November, because that's a ways away, but we'll kind of see. So you'll most likely hear from us when we're ready to bring that before you. The investigator is still getting some documentation together, but it looks like there's so many more this biennium than there was last biennium, but it's actually one incident with several complainants and one service provider. So it's kind of deceiving on the numbers. But we will, as soon as we get all that wrapped up and finished, then we will get in touch with you guys. If it's close to November, we'll just wait till November. If it's prior to that, we'll start. You'll most likely get an email from April trying to figure out what days would work for you guys. So, any questions? Oh, Kelly, you're on mute. No, you're on mute.
There's a delay. Sorry.
It's okay.
I'm at here. So the services provided, I'm assuming that just means that the investigators have worked on the case. Yeah.
Yes, he's working on the case now. He still needs some documents, so he had to send out, I don't know if he had to send out another subpoena or he had to follow up with a subpoena that was sent because not everything was included. So he's still working on getting everything finalized, and then Heather, our AAG, she needs to review it, everything also. But they've been working very closely. They were close to having it for today, but we had it on the agenda, but we ended up pulling it off because they just weren't prepared and weren't ready to present everything yet. So, which makes me think that they will have it way before the November meeting.
Okay. Thanks.
Absolutely. Any other questions before I move on? Alrighty, so do you want me to go first? Okay, so let's talk about Senate Bill 820. So this is the one that takes out, and Michelle can explain a little bit more if she would like to, but this is one that takes out the exemption for the persons who are employed by a local, state, or federal government. It has gone through the process and on the Senate side, and it's in the Ways and Means currently. So the reason it's Ways and Means, it has to go to Ways and Means because there's money associated with it. They haven't decided how much yet, and that's because the revenue forecast hasn't come out. One of the things is OYA had said, hey, we have no problem doing this, however, we're going to need some money to be able to pay the staff at this level. So, which is why it needs money. And so both OIA and Department of Corrections are mainly general fund. General fund, everything gets put on hold until the revenue forecast comes out, which will be on May 26th. So everything just sits in Ways and Means and waits until the revenue forecast. The revenue forecast obviously is when the state projects how much revenue they're going to bring in. So the state's projecting how much general fund there's going to be, and then once that projection is set, then they can divvy up that general fund between, all the umpteen programs that use general fund, and then that will allow them to say, okay, well, we have this much dollar amount, or we can't pass this because we don't have enough of revenue. So that's why the bill is sitting on hold currently. And Michelle, again, can add to this if she wants, but I don't think there was any opposition to removing the exemption. It was more of, we have no problem doing this, however, it's going to cost us money because we can't pay people at the current level and then require them to have the certificate, which is a higher level. So I think that currently is the only holdup. I don't think there was any legislators that had any concerns or issues with removing the exemptions, which would make it mandatory for everyone doing this sexual offense specific treatment be required to be certified unless they're a student or a person of the clergy.
When's the revenue forecast?
I have a question.
May 26th.
Does the Ways and Means ever pass something through as not funded?
Yeah, well, yes, kind of. There's tons of different options that they can do. For one, they can change verbiage to allow for grants. They can change verbiage to allow for other fund, which, don't ask me how they're going to get other fund for OIA. It kind of depends on the agency. OIA will have other funds, but those are usually coming in from some sort of grant or some sort of money that is set aside for a special type of program. It would not be necessarily set aside for this. So the odds of this bill going through without fundage is not going to happen. So if Ways and Means does not fund it with the general fund in order for OIA, it will not pass. Because if it passes, it requires OIA to do that. And if they don't have the fundage, they're not going to make them do something they can't pay for. So any other questions on 820? No? Michelle, go ahead, Michelle. Is there anything you want to add?
Yeah, I'm happy just to offer a little bit of additional information. I mean, yes, bills that go to Ways and Means are typically go there to languish and, hopefully we can bring it back. And I think that was the goal, is that if it doesn't pass this session, we have certainly laid the foundation for the conversations in the next either short session or long session. And what I will say is the Senate Judiciary Committee, every single one of them was very supportive of this and understand the absolute critical need that treatment providers be certified. And so we have built some understanding and I think support around that concept, which is good. The chair of Senate Judiciary is also in Ways and Means, and he was very serious about getting them passed. When we brought it back to his attention, he made it very clear that his expectation is that if we have other treatment providers in the state that are certified and we're not requiring that of our state employees, that's a problem. And so we definitely have his support. And then of the Ways and Means members that we have spoken with, all of them understand and are supportive. It's just a matter, as Sylvie said, is kind of what that budget forecast is and what that looks like. And so what our office will be doing actually next week is sending out messaging to folks with emails, encouraging folks to reach out to legislators now that we're kind of gearing up to that May 26th date. We want this to be, in their inbox, top of mind. And again, if it doesn't pass this session, we have laid a really good foundation moving forward. So that's where we're at.
This is Commenti. Since the foundation, everything is kind of there, is it possible that the short session next year, they could make Ways and Means could return to it and get it done?
So it would not automatically come back from Ways and Means. It would come back from whomever sponsored it, which was the Committee on Judiciary and Ballot Measures 110, right? Yeah. So they would have to bring it back forward. There is a potential that could occur because the revenue forecast keeps coming out, and if the governor has everything opening back up by September 1, then hopefully revenue would be back up, because again, general fund is typically raised by tax dollars, especially income tax. And so if the economy is doing better and more people are working and more people are paying taxes, the revenue forecast will be better per se, and they might fund it then. So there is that potential, yes. All right, any other questions on 820? No? All right. Well, we'll know, like I said, towards the end of I think after the 26th, because there's a whole bunch of bills that are Ways and Means right now, a whole bunch of them. Those 6 boards that might move to us, they're all in Ways and Means right now too, because everybody's waiting until the new revenue forecast comes out, because we're kind of in this different situation that we have been in a really long time, so they have to have that revenue forecast before they're willing to move a whole bunch of stuff forward. So we'll know a lot more at the end of the month. And then there's also, and Michelle, you can correct me if I'm wrong, been discussions about session may actually get done earlier and not go all the way to sine die. So sine die is usually right at the end of June, usually like the last Friday of June. But there's rumors that they're going to be done early, so we might know sooner rather than later. But I think that also depends on everybody at the legislation either agreeing or moving things forward. So, as you know, last year that didn't work so well. So we'll see how things go.
As long as my bills make it to the finish line, I don't care when they end session.
Right. Yeah, and I'm fine with them going up to the 28th as long as they stay there and address everything and just work on things. Yes. All right, and then any other things on legislation before we move on? Okay, and I can't remember because it feels like my weeks feel like years. So I can't remember the last time that we met and we talked and we saw each other. In
November.
And Ann says it was in November that we talked about contacting ATSA regarding being able to publish on our website their juvenile standards. Do you guys remember this conversation? Because I don't. So Ann was updating me on the progress. So she has been in contact with, made an attempt to contact ATSA had a really hard time. And then once she finally got in touch with somebody, they said that they'd already talked to the board. So then we got really confused because then we didn't know what was going on. So I don't know if somebody from the board had contacted them to talk to them about the ASSA standards for the juveniles and the publications and stuff, but so it caused some conflict here at the office. So we finally had to get Heather involved, our AG, and then got some information from an individual there and are still working on whether or not they would agree to allow us to post the standards. I understand their heartburn because of course they get money from people who purchase a copy of, and if we were to publish them, nobody would have to purchase said copy. So we're still working on that. We'll keep you updated. If we know anything prior to the next November, we'll make sure and let you know. There's still, like I said, emails going back and forth. We're hoping to, if they will not allow us to publish their standards on our website, because again, remember, we did not adopt them in their entirety. We only adopted certain pieces because there was things in Oregon that Oregon does that the ASSA standards didn't include. And so this is kind of where some of the heartburn also came on their behalf, was the fact that we didn't solely adopt their whole standards. And so we weren't sure if they would, because we want to be able to either have or publish just the sections that the board has adopted. And so we had asked them if we could, make a packet for our licensees if they requested it, that included a copy of the rules, the statutes, the juvenile standards that we've adopted, and the adult standards that we've adopted, and just make a packet. And then just say, hey, if you want a packet, we already have a fee for it, it's $10, here's your big old packet. Or if we could publish it. So we're still working on that. We'll keep you updated. There's obviously copyright issues when you want to start making copies of certain things or publishing certain pieces of things when somebody has already done the whole booklet. So, but we'll keep you updated on all that. We're still working on it. Any questions on that or any comments?
And I don't, in general, and for the providers here can tell me, do clients have a right to know what standards you're operating under? So if I'm...
Absolutely.
And are you obligated to provide them the ASSA standards?
I don't think so, not specifically. I think if they asked for them, we'd have to negotiate, or I could tell them where to purchase it, but I don't have to pull it out of my desk and give it to them necessarily.
I'm just curious if ASSA has any ethical reporting, as an association. I mean, so, and maybe it's outside the context of here, but if we're referring to those standards, and I'm just thinking clients' rights, and if you're a provider who is saying you're following these standards, and the client, well, what are those standards? And if you have, obviously, we're the regulatory body, but does ASSA have any regulatory authority, or can they take a member and say, you can't be a member anymore because you violated rules?
Yes, they can do that. They have an ethics committee and a grievance process for people who violated.
Yeah, I just think
you can be expelled from the organization.
Just thinking of those that are being served in their rights to know what standards the provider is operating under, and the right for that information under disclosure. So it just we as a state regulatory board, of course, provide everything and make it public information, and I don't know, it's something that those that are involved with that so may want to consider a transparency piece.
Yeah. And yes, and we've had that conversation, and we do have copies here at the office. Obviously, for if we get a complaint, we have to have the standards to be able to say, oh, here's where you broke the rule. So we have those. Then they were willing to give us copies of those for free because we are the regulatory body. The other thing to add to that, Malcolm, is that there is no requirement in Oregon that the certificate holders must be a member of the association. So that's kind of where there's the disconnect. So even, because you can still have providers out there who are not members, and if they're breaking their code of conduct, the association has no control over them because they're no member. So which is where we come into play, which we should come into play first anyways, but because we can take your certificate away and then you can never work. But Nathan?
Yes.
You're creating some sort of electromagnetic field, is my theory.
They say they can't hear me.
Me as well.
You're not muted.
Yeah, I think, Malcolm, the same requirement of being transparent about that, I think, applies to us. I've never seen it written in policy anyplace, but I keep 3 copies in my office too, so if it became an issue, I would certainly at least loan them a copy to read if they needed it, and I would expect anybody else to do the same thing.
Yeah. I just think...
Picking up sound. But it can't hear you.
Can you guys hear me at all?
Yeah, we can hear you now.
Yeah, can now.
You guys are going to give me a heart attack.
And as a regulatory board, ensuring clients know what their recourse is and what, standards when they go to a provider. Not that the provider has to be ATSA at all, but those are... And do you see that in any other, from any other boards where, like, the person providing the service is providing their customer or client, information or required to provide information about if they have a problem, where they need to go or what to, I don't know, if you go get to a esthetician, do they provide you with a document of how I file a complaint?
No, but they do have certain rules that says that their license has to be posted in public view. Cosmetology is a bit different because it's very large and it's been around for a really long time. But we do have other boards that in programs where you do have to say, I'm licensed and regulated through here. If you have a complaint, here's where you contact this, and so yes, that is a requirement because that is, for one, that all you guys and us, that is our goal, is to protect the public. So it is about making sure that people are doing what they're supposed to be doing and doing it appropriately and then following through with complaints. So, yeah.
I think for providers, that should be in their disclosure statement as a standard practice.
Come here, statute book. Isn't that already in, I think that's in our rule, that you have to disclose that what type of license you have and how to contact us if there's a complaint. Isn't that part of your guys'?
Yeah, I believe so, and yeah, like Bill said, it's part of kind of our, the licensing ethics too and requirements. Just look that, Yeah,
because I do believe you guys have a disclosure that must include, and make me wing it right here.
Complete an application.
That's to qualify. Social workers. This is what happens when you make me wing it. I gotta actually read.
You have to have active. Oh, it's in the terms. Here it is. There's what's in the disclosure statement.
So legally, so here's the definition of professional disclosure statement. So in your disclosure statement, it lists a whole bunch of other things, but it says number F is the name, address, and telephone number of the Sexual Offense Treatment Board. So in your disclosure statement, there must be the name of the board and how to contact. So that's under definitions in statute 675.365(7)(f). And I think in rule we have it done out too, but. So anything else? Nope. Okay, so we are on item number 4, which is public and interested parties feedback. This is Sylvie. Has anybody logged into the phone line? So there is no public that is logged in. We'll move on to item number 5, which is other board business. So again, we've already said that November 12th is the next board meeting. And if we have that case ready, well, it's cases, but it's one issue. If we have that, we will get in touch with you and start seeing what dates will work for everybody. And then it will be a very short agenda. It'll just be the call to order, approval of the agenda, and then go right into executive session and discuss the case. And then come out of executive session and you would make a decision on the cases. And that would be it. That would be, so the only thing that we would, so just so you know, and we can try and do it, and when April sends you the information, we have no problems doing it 8 o'clock in the morning if that's better timing for some of you. But we can do it at 9 o'clock too, that's fine. When she sends you the email, we'll kind of figure that out. Does anybody have anything that they want to make sure is on the agenda or anything you want to talk about? Kelly, yeah.
Yeah, I've got a couple of things.
Sure.
Mostly just information, but also a continuation of previous discussions that we've had. There is a group of juvenile offense-specific therapists that are meeting. It's called the Therapist Summit. And that group is putting together recommendations for standardization and regulation of how polygraphs are used. And that group is bringing in some polygraphers also to really look at how we can have some standardization. So what we're seeing now is that there are some places that use what I would say would be a full disclosure paperwork that you would use with an adult with juveniles. And there's concern that some of the questions that would be on that paperwork you would use for adults could be very disturbing to be asking a juvenile about it. So that's an example of what this group is kind of looking at. Once they come together and finish and finalize what their recommendations are, the plan is to take that to the SOTB board, the Oregon Adolescent Sex Offense Treatment Network, to get their sign-in. And once that happens, is then to bring it to the SOTB board to see if the SOTB board wants to adopt it, how we would adopt it, whether that would, I don't know how all that works, if it goes into rules, if it has to be legislative, whatever. But at some point, and hopefully maybe by the November meeting, that would be something that would be being brought forward. And then the other thing I wanted to bring up is that we had talked in the past about looking at what the criteria is for the education that we're requiring people to have to maintain their certifications. And I think OASA was going to be working on some ideas, and OSOTM has a small subgroup that's working on some ideas. Hopefully those two groups are going to get together at some point, looking at also as with OSOTM, we're really concerned to make sure that new people coming in are getting the kind of training and education that really will help them be able to do this job. And unfortunately, there isn't like a coursework at one of the universities in the state. There isn't any standardization in that way. There is an organization called the International Trauma Association is actually putting on a 24-hour training to be a certified sex offense specific treatment provider. OSOTM is paying for 2 of us to attend that so we can see what that looks like and whether or not they're covering the things we would expect to see covered, and possibly using that as a standard if it looks good, or at least getting some ideas from it. So those are the 2 things I wanted to throw out there. I'm interested in anybody's comments, feedback on that.
There was a time many years ago when an outfit out of the Midwest did the same thing, and they really kind of bumped into the states, a lot of states, tried to kind of bully their way into being the standard at that time, and really it was kind of a sham when you got right down to it. Kind of a money-making scheme for the outfit that put it together. So I would just encourage you to go thorough and go carefully before you commit to anything over there. We're finding it on the adult side with the Department of Corrections and so on, that the definition of what sex offender treatment is very interesting in some people's minds, and doesn't exactly match what we feel are appropriate practices.
Yeah, Kelly, I'd be curious about, the people that you're sending, what they think and what's covered and,
Yeah, and Kelly, if you do get any information and you want to have the board discuss it in November, we will need that in advance. We, meaning the office, will need that, not the board. And just remember that anything and everything that this office gets is public record, and everybody's entitled to it. So, if the group is not prepared for whatever it is that you're working on to be, quote, out there to where anybody can see it, then obviously don't be giving it to us until they're ready for that, because once we get it, it is a public document and anybody have access to it. So just, sure. But if you want the board to review it in November, we have to have it in advance in order to get it on the agenda. Again, these meetings are public. I know nobody called in, but they are public. And so all the documents we have to have in advance and becomes part of the public record. So just letting you know.
How far in advance do you have that?
Usually I would say about 5 to 6 days before the board meeting. Yeah. Because we do the dry run the week before, so we'll need it for that.
Okay.
And if you're close to getting it, just you can email one of us, mainly Ann, but any of us would work, and just say, hey, I'm working on getting these. I should have them to you shortly. But then we can at least get on the agenda an item for it. And then if we don't end up getting it in time, we can change the agenda to remove it. It's always easier to remove something from the agenda than it is to try and add something at the last minute.
Great, thank you.
Absolutely, yeah. And if you don't have any documents, we can still talk about it and talk about what's occurred and what you guys have working on. So, yeah. Anything else anyone has? Nada. All right, Kelly, other Kelly, you have a script for the adjournment.
Yes, I do. The Sexual Offense Treatment Board meeting is adjourned at 9:59 a.m.
Okay. Recording done? Recording's off.